The CECC reported 2 COVID-related deaths involving young children on Thursday. One was a 4-year-old girl who developed encephalitis and died on May 20th.
The other was a 1-year-old who died from septic shock 7 days after her COVID diagnosis. Officials also announced one critical COVID case involving a young boy with cancer.
一位4岁的女童，她人是可以走到医院去的。
A 4-year-old girl who was able to walk into the hospital suffered full-body convulsions while waiting for medicine.
On May 19th, the CECC announced a case of encephalitis in a young child, a 4-year-old girl. The child was sent for emergency treatment but died at the hospital on May 20th. On Thursday, the CECC gave more details on her case.
We have collated more information on her death. Today, the cause of death was officially determined to be encephalitis arising from COVID.
At its Thursday press conference, the CECC announced that 2 more children had died from COVID. One of them was a 4-year-old girl without a history of chronic disease. After infection, she developed a fever and full-body convulsions. She was admitted for treatment and died on May 20th from encephalitis and multiple organ failure. The other death was that of a 1-year-old girl with a history of intestinal atresia. On May 16th, she developed symptoms including a fever, spasms, and lips with a purplish tinge. She was sent for emergency treatment and died from septic shock on May 23rd.
总共是16例的这个儿童的重症，其中有7位是脑炎。
So far, there have been 16 children with severe COVID symptoms. 7 developed encephalitis, 5 developed pneumonia, 2 developed sepsis, 1 developed acute respiratory distress syndrome, and 1 died at home.
The CECC also reported a new critical case involving a young child. The case involves an unvaccinated 7-year-old boy with cancer and a history of long-term respirator use. After his diagnosis, he developed pneumonia and acute respiratory distress syndrome and is currently under intensive medical care. On Thursday, the CECC also shared some good news. Out of the 7 children who developed COVID-related encephalitis, 1 was on his way to recovery.
This is the case of a 1-year-old boy with no history of chronic disease. He was taken off his respirator on May 23rd.
Dr. Li Bingying says it's hard to prevent encephalitis from developing in COVID-infected children. In a radio interview, he compared the current COVID wave to the 1998 enterovirus outbreak and expressed concern about COVID's long-term effects.
Perhaps in some people, the infection reaches the nerves. There are a lot of nerves in the face that connect directly to the brainstem. The virus enters the brainstem directly, posing a big threat to the patient. In patients with severe enterovirus infections, of course, there are a lot of patients who recover well, but there are some children who develop conditions in the nervous and muscular system that persist afterward. Of course, we should do everything we can to prevent that.
The CECC urged parents to seek medical help for children with warning COVID symptoms. For children with neurological symptoms, neurological teams will participate in the rehabilitation process to ensure that they get the support they need.